Hi everyone, welcome to our program development presentation. We are the medication adherence team and we worked with Caitlin Stewart in the acute department at the University of Colorado Hospital. Looking at our prioritized needs and the underlying causes, our first need is a consistent approach that can be used to effectively address patient medication management and adherence prior to patient's discharge. Our second need is that the OTs should be addressing and discussing patient medication habits and routines with all patients during their initial evaluations. And this program we created will serve the OTs in the acute department because they are the ones implementing the program, and it will also serve the patients in the acute department because they will be receiving the program and its benefits. Some underlying causes of these needs include the inconsistency of OT staff addressing medication management with their patients. Some address it while others just skim over it. This results in a need for a universal approach to addressing medication management throughout the interdisciplinary team, as consistency is important for positive outcomes. This was also found and discussed as a problem in the article by Schwartz and Smith called Integration of Medication Management into OT Practice. Another underlying cause is that there's currently no emphasis on medication routines and habits during the OT evaluations or interventions, and yet routines and habits play a large role in managing medications. This information was gathered through communication with one of our key informants, Carol Seibert. A third underlying cause is lack of communication and information dissemination across the interdisciplinary team regarding medication management, and this includes nursing and pharmacy.
If the identified needs go unaddressed, there will be negative implications for OTs and patients at University Hospital. Specifically for OTs, there will continue to be inconsistencies for how they address medication management. This will impair their ability to understand patients' current skill level and their medication routines, which will lead to barriers going unidentified. There will also continue to be a lack of communication between the interdisciplinary team for making modifications before discharge. This will interfere with OT's ability to fulfill their role of providing patients with supportive modifications to their medications before they discharge. The negative implications for patients are that they will continue to be discharged from the hospital with unidentified performance barriers. This will affect their ability to perform the tasks required for managing their medications, and as a result, patients will either incorrectly manage their medications or not participate in medication routines at all. This can lead to disruptions with other daily occupations such as self-care and IADLs due to the side effects of medication mismanagement. Our community partner is interested in developing a program that OTs can implement to effectively address patient medication management in hope of reducing hospital readmission rates. One of the critical capabilities of UC Health's acute OT department that must be considered is their short interaction time with patients before they are discharged from the hospital. The OT department needs a program that can quickly identify patient barriers related to medication management in order for them to provide recommendations for improving the physical supports a patient will have upon returning home. Being that they are at a hospital, there are other resources available to help them implement this program. These resources include pharmacists for changing medications, nursing for providing additional education on medications, as well as their electronic health record, EPIC, which can be modified to document OT recommendations. After completing the needs assessment, our group has created a program goal and objectives to help guide the development of our program. The goal is to have a universal medication management approach for all OTs in the acute department. Our objectives include OTs implementing medication assessments to screen for patients' performance skills and their medication routines during evaluations. OTs will thoroughly document any of the performance deficits from the assessments as well as the recommendations, and they will collaborate with pharmacy to make changes to medications prior to patient discharge.
In order to meet our program goals, we've outlined a few program activities. First, we will modify electronic health record, or EPIC, to include the OT evaluation screening tool for medication management. Secondly, we will train OTs in completing the screening tool in EPIC through an in-service. Thirdly, we will educate pharmacy and nursing staff on how to access and use screening results and OT medication management recommendations through a virtual meeting. Lastly, we will collaborate with the Medication Management Program Implementation Liaison, Chris Noren at the University of Utah Hospital, for strategies and advice on how to best implement a program such as this, as they have done so in their hospital setting. As for the program outputs associated with our activities, first we will have a completed OT eval screening tool in Epic for every OT patient that includes identified barriers to medication management. Patients with identified barriers will receive client-centered supports and resources. Through our conversations with key informants and through our literature review, we understand that the underlying issues or barriers to patient medication management and adherence is vast, and each patient presents with their own unique situation. OTs are distinctly suited to identify such barriers and concerns and create those client-centered plans and strategies for supporting their ability to perform and participate in this critical IABL. All OT staff will assess medication management using the screening tool with all patients. Periods of care transition, such as a discharge from a hospital to their home or other location, present numerous opportunities for exacerbation and inability to manage and adhere to medications, whether it be a new medication, a change in a medication, or lack of communication between the care professionals and patient. The importance for screening for and addressing barriers to medication management is critical for supporting adherence. The interdisciplinary team will have access to the OT recommendations around medication management in Epic. Through our research and conversations, we understand that the knowledge and skills from various disciplines can optimize medication management decisions, patient education, and enhance medication adherence. Therefore, incorporating the OT perspective and recommendations in these efforts is important when aiming to be comprehensive.
A big part of our program implementation involves modifying the EPIC system at the hospital in order to incorporate our medication management assessment and findings, as well as to communicate recommendations to pharmacy. The picture on the top right of the screen is part of the OT initial evaluation documentation that is currently used by the acute care OTs. If you are unfamiliar with EPIC, basically there are dot phrase options that allow the OT to insert text into the note. Further, the text highlighted in green are areas that prompt the OT to select pre-written options. For example, for OT level of assist, there are options of min, mod, max, etc. The picture on the bottom right hand of the screen is our medication management evaluation screening tool that can be incorporated into each OT's initial evaluation note using a dot phrase. The OT will then be prompted to select an option for each question. For example, if the client does manage their own medications, then the therapist selects yes and is prompted to complete the Medicog, which is a medication management specific assessment. Notice that our screening tool is quick and easy for the nature of the acute floor. However, it incorporates primary deficit areas related to medication management, including the patient's medication routine. It is important for the tool to address multiple different areas and also to include a free text section because according to Schwartz and Smith, the underlying issues or barriers to patient medication management and adherence are vast and each patient presents with their own unique situation.
For performance and participation outcomes, we'll look at the OTs. So they will improve their competence in evaluating medication adherence, resulting in increased participation and performance for addressing medication mismanagement. They will also increase their recommendations to pharmacy, and this will increase their participation in communication with other disciplines. Additionally, the OTs will increase their performance abilities to identify barriers and be able to include those on discharge documentation. And for the patients, as the OTs identify and eliminate barriers, maybe by adapting prescription packaging or labeling, for example, they will increase the patient's performance skills and abilities, resulting in increased participation in medication management.
All right, so this then brings us to our program outcomes and impacts. Our outcomes include increased OT competence to addressing medication management, improved patient medication adherence following acute care discharge, as Mixon and colleagues explain how screening for and addressing barriers to medication management is critical in supporting adherence. Thirdly, the creation of medication management specific orders for home health. And then the interdisciplinary use of OT recommendations to support patients' medication management. This outcome is supported through our conversations with Chris Noren, who explained how their medication management program has resulted in the pharmacy using OT recommendations to make modifications to the patient's prescription bottles. Our intended impacts include improved continuity of care from hospital stay to discharge location, decreased hospital readmission rate related to medication mismanagement, improved patient satisfaction with healthcare experience, and then the potential for this UC Health OT department to be a model for how to assess and address medication management in the acute care setting that can be replicated in other UC Health hospitals.
Our resources include EPIC, so the electronic medical record system, Chris Noren, who is our medication management program liaison from the University of Utah Hospital, the OT staff already in the acute department that are fairly new and willing to implement changes and ready to work, and the medication management screening tool, which includes an assessment and some question prompts. Caitlin Stewart, our community partner, she will provide in-service meetings to train the other OTs in the department on this new program in January and educate pharmacy and nursing staff on how to locate and then implement OT recommendations for medication management for each patient. And with costs, we do not anticipate any additional funding or costs in order to implement our medication adherence program because all the resources for this program are currently available at the University Hospital. Additionally, the Medicog assessment we are implementing is free to the public and available for download online.
In order to assess whether our program is effective, we have a few program evaluation questions that we would like to ask and then look into. Here we have our 3 questions. The first is, how consistently are OTs implementing medication management screening and using the documentation fields? Our data source for this will be self-report from the OT staff and review of documentation. Personal communication will happen through staffing meetings and then review of the EPIC eval documentation. We anticipate that this should happen every month, beginning in March of 2021, which will be 1 month after implementation. The second evaluation question is this location of UC Health seeing lower medication mismanagement related readmissions? Hospital admission data will be used to look at this specific evaluation question, and review of this admission data would be every 6 months. So the first time looking at this data would be June 2021, which is 6 months after the initial implementation. Lastly, we want to know how are pharmacy and nursing staff using the OT recommendations related to medication management. We would access the self-report of pharmacy and nursing staff through personal communication, most likely during rounds or staffing meetings where the interdisciplinary team comes together. We anticipate that the time frame for this would be monthly, beginning again a month after initial implementation, so March of 2021. As this is a new program, this is a critical time, that first 6 months, to gather high-level data related to program success and make adjustments as necessary. We would take feedback from all involved and make changes as such to make it more effective. Our community partner, Caitlin Stewart, is initially responsible party for evaluation activities, but as implementation happens, more key stakeholders should come on board, and so responsibilities could be further delegated.
Here's our logic model, which basically provides an overview of everything that we've talked about in our presentation thus far. Looking at the model, you can see the process of our program and how our resources connect horizontally to our activities and so on, eventually resulting in our intended impacts.